Hello, everyone, and welcome to Heads Up, the weekly podcast of the National Headache Foundation. This is Dr. Lindsay Weitzel, migraine strategist, founder of the Facebook group Migraine Nation, and chronic daily migraine survivor. I am here this week with Dr. Betsy Seng. Dr. Seng is a clinical psychologist. Hi, Dr. Seng.
Hi.
She is also an associate professor at Yeshiva University at Albert Einstein College of Medicine. So we are doing a 3-part series on behavioral interventions for migraine, and this is our 3rd part. It's been really fantastic. I hope everyone has learned a lot. I know I have. So in the 3rd part today, we are going to discuss mindfulness and migraine. If you'd like to go back to part 1 and part 2, which were really awesome, part 1, Dr. Seng and I discussed biofeedback in migraine, and in part 2, we discussed cognitive behavioral therapy in migraine. So today, let's kick off our talk on mindfulness, what it is, how it applies to migraine, and how it can help. So Dr. Seng, can you start by just defining mindfulness for us? Tell us what it is and what it's about.
Mindfulness is a very specific and intentional way of paying attention to yourself and to the world around you. So when you are paying attention mindfully, you're paying attention to the present moment. You're not thinking about the future. You're not thinking about the past. And you're also trying to pay attention in a way that's non-judgmental. That doesn't just mean that you think everything is great. In fact, that's a judgment, right? We're trying to just experience our life and our world the way that it is without necessarily making value judgments about everything that happens to us.
Okay. All right. So I have what I think is a very important question about mindfulness. As someone who I had my daily migraine from the time before my memory began. I was very small. I was a toddler when mine started. So my memory began with pain. And so I feel like it can sometimes seem helpful to many of us when we are in extreme pain to sort of distract ourselves when the pain is too intense. And some of us may even learn to live a lifestyle of distraction. This seems like it's opposite of mindfulness. Does this mean this is a bad habit to get into, this distraction?
Distracting when you're in acute pain can be a really, really effective coping strategy, but it's not the only coping strategy. And just like you talked about right now, that sometimes when you get into the habit of distracting when you have an aversive situation like a migraine, you end up falling into this habit all the time and distracted even when the situations aren't quite as aversive and when that may not be as adaptive. Mindfulness is another way to handle aversive situations, where rather than trying to pull yourself out of them, you let yourself experience them, but hopefully you're experiencing them in a way that doesn't feel as painful because you have, done a lot of work to try to be able to disentangle how aversive the situation is from the emotions and value judgments that go along with that. This is bad, and I need to stop it somehow. Cultivating the skill of mindfulness is a long-term strategy. It takes a lot of time and a lot of skills, and it's the kind of thing that you're going to want to end up practicing a lot all the time and using in your day-to-day life. Distraction is a really useful tool that can be taught much more quickly and can be pretty effective for a lot of people. So it's certainly not a bad idea at all to use distraction when you are in acute pain. Obviously, in one of our earlier sessions, we talked about how certain types of meditation, when you use them with relaxation, so when you use imagery with relaxation to cope with migraine, the whole point is to try to help just really, really distract you and distract your senses and to get you out of the migraine pain. These are different tools in the toolbox, and different tools are going to work for different people and at different times in their life.
Okay, well then let's move into how does someone learn mindfulness? How do we go about teaching this to ourselves, how to do this?
Yep. There are both formal and informal ways that people can start to learn what mindfulness is and can start to practice it and then maybe incorporate it into their lives.
Mm-hmm.
Many people are probably more familiar with mindfulness than they may realize. If you've been going to yoga classes recently, or if you've downloaded popular meditation apps, many of these kinds of experiences now include a mindfulness meditation component, where the goal is that you're not trying to change your breath, you're trying to focus on what your breath feels like and to be aware of it non-judgmentally, or where you're not trying to change your muscle tension, but you're trying to notice what your muscles feel like and non-judgmentally just experience that. So people may be encountering mindfulness in various ways in their life. People may download meditation apps. Many of those meditation apps that are currently available on the market do use mindfulness as their basis for their kind of theoretical orientation, a psychologist would say, for how they conduct mindfulness.
Right.
And that can be a really good entree. However, for people who really want to get the most benefit out of mindfulness, the meditative practice is important, but it comes along with changing the way that you go through your whole life. So when we're teaching people mindfulness, we talk about how you go through life on autopilot,
Right.
and you just kind of react. You just respond to the things that happen in your environment without necessarily spending a lot of time thinking about them.
Mm-hmm.
And the goal of mindfulness is not just to help you feel better in the moment when you're meditating, but for you to use those skills to help respond in a more adaptive way, in a way that is less reactive and more thoughtful to all the situations that happen in your daily life.
Okay, that leads into another question I had is, can we discuss a little bit how mindfulness is different from meditation?
Yeah. So meditation really refers to any reflective practice where you sit down with yourself and typically with some kind of focus. That could be an audio tape, or it could be a mantra that you've written down, or a positive self-statement.
Right.
It could be a religious verse, right? And you engage intentionally in being aware of your own thoughts and feelings around that. Mindfulness meditation is just a specific kind of meditation where we're trying to pay attention in the present moment non-judgmentally.
Okay. So I have a question that I think many people with migraine, it comes into their mind, or with chronic pain, when you start talking to them about mindfulness. And I think that a little bit of fear comes up. If I allow my brain that always wants to be distracted when I'm in pain and wants to just sort of go somewhere else, and I start being mindful all the time, is my pain going to get worse?
Yeah.
At first. Can we talk about that for a second?
Yeah, absolutely. So I don't think that there is much evidence that you're seeing an increase in pain severity as people start to learn how to do mindfulness.
Okay.
But what you're talking about is absolutely true. Mindfulness is a long-term skill, and many of the ways, the possible mechanisms through which mindfulness reduces the burden of disease are going to be through the daily use of mindfulness in your life. So if you think about the typical life of a person with migraine, if you're going through your day, you've encountered various migraine triggers. Some of them you've handled successfully, some of them have gotten in your way. If you're trying to cultivate this constant sense of non-reactivity, not just reacting, but being thoughtful, you may be able to respond to potential triggers in a more thoughtful and measured way. And when things don't go your way, the hope is that your body won't be as responsive to your day being thrown off, so that you'll be able to be more even keel. There are a lot of ways that mindfulness, though, may also help during an acute attack, and certainly for people who experience things like chronic lower back pain, people who do experience, active pain all the time. Using mindfulness meditation does seem to reduce pain severity. It does seem to help people experience the negative pieces of pain less.
Okay.
when they're experiencing it. But again, it's kind of a long-term strategy that it takes time to cultivate.
Okay.
So it's a good thing to continue to use the other tools in your toolbox when you
Mm-hmm.
need to. The other thing is that we're talking about trying to use a brand new skill during an acute migraine attack.
Right.
I probably wouldn't recommend doing
Yeah.
anything the first time during a migraine attack, right?
Yeah.
This is something that you want to be able to practice every day, maybe even for a whole month before you try to use it during an attack itself.
Right.
Build up those mindfulness muscles before you try to really use it in the middle of the battle.
Right. So let's get to mindfulness and migraine. How is it that mindfulness improves our migraine disease? Is it by, decreasing the amount we panic, or does it actually do something in our system that decreases, the disability associated with migraine?
Yeah. So the most accurate answer is that we don't know yet. There have only been a handful of studies that have looked at mindfulness-based interventions in migraine specifically.
Okay.
We know a lot more about mindfulness and chronic pain and potential mechanisms. But I think the most important thing for people with migraine to know about using mindfulness, any of these mindfulness strategies,
Mm-hmm.
and migraine, is that all of the studies have shown big reductions in migraine-related disability.
Okay.
So how much migraine is impacting your day-to-day life, how much each attack is interfering with your ability to go to work, to spend time with your family, mindfulness does seem to have a positive impact in that regard.
Mm-hmm.
Regarding frequency and severity, the effects have been smaller.
Mm-hmm.
And sometimes we haven't seen them. In some of the studies, we haven't seen them at all.
Mm-hmm.
So it's actually unclear whether for people with migraine, practicing mindfulness will necessarily reduce your attack frequency.
Mm-hmm.
The other strategies that we talked about in the previous times that we spoke all have demonstrated evidence to reduce attack frequency.
Mm-hmm.
Mindfulness seems like it's probably going to be more useful for people who have some effective prevention on board,
Mm-hmm.
who are doing what they need to do, but man, migraine is really still getting in the way of their ability to engage in their daily life.
Mm-hmm. Okay, so just really quick, I'd like you to touch on, if you can, which you did a little bit, but I think all of us who read in the migraine community, we see this acronym everywhere, MBSR, which stands for mindfulness-based stress reduction.
Yeah.
And can you just tell, is that different from what we've been talking about today? What is that all about?
Yeah. So we talked about the informal strategies that you might use to start to cultivate mindfulness as a skill in your migraine toolbox.
Mm-hmm.
There are three major formal ways you might consider cultivating mindfulness for your migraine toolbox.
Mm-hmm.
The first is mindfulness-based stress reduction. Mindfulness-based stress reduction is a 8-week group treatment that was developed by John Kabat-Zinn at Harvard that has been used to reduce stress in a number of different disease conditions. The groups are widely available across the country. The people who lead them don't necessarily have to have specific clinical training.
Mm-hmm.
They're people who are interested in mindfulness and who have gone through the training, and that can be a really, really good entrance to people who think that they may be interested in mindfulness. And it's especially good for people who may be able to take this new skill and apply it to their migraine, apply it to their own lives without needing a lot of hand-holding.
Okay.
Mindfulness-based cognitive therapy is kind of the next step up. It includes some mindfulness-based stress reduction pieces, but it also includes some cognitive therapy pieces. And a couple of us, including myself, have been adapting mindfulness-based cognitive therapy specifically for people with migraine.
Mm-hmm.
So that it helps guide you a little bit more to say, okay, we're learning this meditation skill. How do I apply that to my life as a person with migraine?
Great.
So that's what MBCT does.
Okay.
It's also
we did touch on that in the cognitive behavioral therapy piece we did.
Yes.
Everyone knows. Okay, go ahead. I'm sorry, didn't mean to interrupt you.
No. And then the last is acceptance and commitment therapy. Acceptance and commitment therapy uses mindfulness skills to try to promote the willingness to experience aversive things like migraine, as well as committing to engaging in whatever it is you really, really value in life. So I'm sure everybody with migraine has a list of things that they feel I've had to give up or I've had to really cut back because of my migraine disease.
Right.
And act's goal is really to help you identify those valued activities and to help you move towards increasing the amount of time you're spending in your life doing those things.
Okay. All right. Thank you for that summary, because we do see the acronyms when we read, and it helps to know what the difference is between the things that we're talking about, especially those of us that are online and we're really active in the migraine community. We want to know what all these things are. Is there anything else you'd like to add to our discussion of mindfulness and migraine?
I just want to share a little bit of a personal tidbit. I started practicing mindfulness probably 14 or 15 years ago. I've practiced it at various levels on and off over the course of that time. And I have to say that it's been a very difficult skill for me to cultivate, but it's also been very rewarding. So I would encourage people who are interested in it to know that it can take really savvy people a long time to really start to incorporate it well into your life. But that for people who are interested and who want to put in that time, it can be really beneficial kind of broadly across a lot of areas of your life and your health.
Oh, I love that you said that. Thank you. And thank you everyone for joining us today. So this is Lindsay and Dr. Seng signing off of a 3-part series on behavioral treatments for migraine. Again, we hope you all learned a lot, and you can go back and look at the other 2 on biofeedback and cognitive behavioral therapy. We hope everyone has a wonderful day, and we will see you again next week.